Hi, my name's Alex Weintz with the Oklahoma-based public affairs firm Amber Integrated, and you're watching Quarantine Corner. Our guest today is the president and CEO of the Oklahoma Hospital Association, Patti Davis. Patti, thank you for being here today. You, of course, have you and your association have an enormously important role in any circumstances, but certainly during a global health pandemic and one that has hit Oklahoma. So I appreciate you taking some time out of your busy day to be with us. I want to sort of set the stage here at the beginning of 2020. The Hospital Association is working with legislators on a variety of issues, Medicaid reimbursement rates, the normal sort of access to care issues, support for rural hospitals, the potential for Medicaid expansion. All of a sudden, I believe in early March, we have the first COVID-19 patient identified in Oklahoma, and of course, the rest is history. How did life change overnight for your association and your mission? And how did you kind of pivot to meet the needs of your members and to hit this crisis head on?
Well, Alex, thanks for that question. And you framed that up very well. Literally, we were in the throes of a very busy legislative session, and then we got our first case in Oklahoma. We watched the national news. We knew what was going on in Washington State and California. Fortunately, we are blessed to be connected to the other hospital associations across the United States, and we started getting immediate information from the presidents of those associations about what was happening in their states and basically help prepare us for what we should be thinking about as this virus started popping up in other states as well. So they provided excellent roadmaps of things that we should consider doing, whether that be working on surge plans with hospitals, whether that be looking at executive orders and loosening of federal waivers to help address this coming forward.
Yeah, that makes a lot of sense. So moving forward, or retrospectively, if you want to talk about from March onward, what have been the biggest challenges, the biggest needs that hospitals have been facing?
Clearly for our hospitals, they read national news, they watch the media, they saw what was going on in other states. And I think the most immediate thing that began to happen in Oklahoma for our hospitals is they saw the absolute supply chain disruption beginning for their availability of personal protective equipment to protect their healthcare workers. At the same time as positives started becoming more prevalent, it became very apparent that the ability to test was significantly limited. And quite truthfully, most of that was because of supply chain disruptions as well. The hospitals were looking at other states' postponement of elective surgeries, and this was not something that the hospitals wanted to do, but looking at preserving personal protective equipment, this was a proactive thing that they felt they needed to do in order to be ready for the onslaught of COVID patients that may be coming through their door. So those were the most immediate challenges, and those challenges, quite truthfully, are still very much in play today, some 40 days later.
I think that it's fair to say that the response to COVID-19 has been very much a partnership between the state government, county and local governments, hospitals, the private sector. What are some bright spots that we should know about in terms of cooperation with hospitals and the state government in terms of getting ready for this challenge and making sure we're prepared?
As the preparations began, it became very clear that this was going to move out of just a response by the Oklahoma State Health Department. And I will tell you that I've been fortunate to meet a good number of people on Zoom and on conference calls that have been extraordinary to work with. And when this is all over, I certainly hope that we can meet and have dinner. The folks at the Oklahoma City County Health Department have some tremendous people that are very well vetted, that have been stellar to work with. As the governor has stood up his solutions task force, we have been working with the National Guard regarding preparedness. So there have been some bright spots. We've certainly enjoyed working with Dr. Casey Schrum and Jerome Lothridge and the governor's staff as we move forward to get the things done to prepare not only our hospitals, to make sure that our public and our patients knew what they needed to do well as well.
Sure, and one of the things I believe that you and the Hospital Association took the lead on was really the surge plan that Governor Stitt unveiled at a press conference a few days ago. Can you talk a little bit about that process and maybe some of the substance of the plan?
Well, as I've already mentioned in earlier parts of this interview, as you start to see what's going on in other states, if it does not strike a sense of urgency when you are representing the hospitals in Oklahoma for the need of being prepared for a surge plan, nothing will. So we were contacted by Secretaries Lothridge and Schrum to say, would you please put together a surge plan for the hospitals? And by the way, you have 7 days to do that. That was quite a monumental task, and we had to quickly put together a very small group of content experts to try to build a surge plan and meet the governor's timelines.
Well, I'm glad we've got that plan in place. Is it fair to say that Oklahoma seems to have, as of today, so we're talking about the very end of April, the beginning of May, escaped the kind of drastic surge that we've seen in other states, or should we still be prepared for the possibility of that? Kind of what do you think we can and should expect to be prepared for?
Well, that's an excellent question. And from my perspective, when we were brought in to help design a surge plan, we were given the model that the governor chose to make projections on, which is the IHME model. And we have been following on a daily basis other models as well. I know the governor's staff does that as well as the state epidemiologist. I think the thing that was most interesting to us is in looking at Oklahoma's results and trying to mesh those up with a model. We were not seeing as significant of positive rates and increases that really modeled any of the models we were looking at. So for now, I am glad that the surge did not occur to the magnitude that was expected initially. It's important to note that IHME model was based on social distancing policies being kept into place a longer time. So it's yet to be seen as we open back this economy if we don't see waves of this virus showing up. We're going to know pretty quickly, as they've determined that a 2-week time frame is really going to be a parameter if the numbers start going back up. We've heard the governor, we've heard our mayors say, we will reverse course. So clearly that's something that we're going to be looking for and our hospitals are going to be looking for. The other thing is there is a very, very real possibility that this disease is no different than any other seasonal virus like influenza, and this could be back in the fall. So while we may have dodged a bullet in April on a real overrun of the healthcare system, that's not to say it couldn't happen at a later time. It's going to depend on how well Oklahomans do with social distancing. It's going to depend on how many tests that we can get out and start testing Oklahomans, because up to pretty much this week, we've been limited on ability to test. And then the third thing is going to be depending on whether or not the federal government can get a vaccine brought online quick enough for next fall, that would be an absolute long shot.
Right. Have you started to see these things that were in short supply, testing, PPE? Has the supply of that started to catch up to the need, or are those things still hard to come by?
PPE is still a challenge. It's been interesting that on any given day, I may get 10 emails a day from some supplier promising that he's got the best prices to China, but the supply chain disruption on PPE has been immense. It's all 50 states trying to get what they need, plus hospitals trying to get what they need. And unfortunately, there are some folks out there that are not good actors that are taking advantage of the situation. But the adequate supply of PPE, I will say hospitals are managing. Are we back to where we were prior to this hitting? The answer is absolutely not. We know that N95s are still of concern to our hospitals and our employees because they're used to having one, taking it off, throwing it away, putting another one on with the next patient. We still know that reuse is going on, and this is not a comfort zone for any of our healthcare workers. So PPE is still a challenge. Testing has significantly improved. Just as things were being said in the media by elected leaders about availability, the fact of what was being said versus what was actually happening on the ground were two different things. So the supply chain for testing was also disrupted, whether that's for the swabs to do the test or the extraction kits or the reagents to run the test. At any given day, we'll find out that there's hiccups in that supply chain. When that occurs, that delays testing. So testing is better, and we know that the federal government is ramping up a lot of efforts on loosening approval times for getting new things on the market. But I would dare say, had this coronavirus hit and we would have had adequate PPE and adequate testing, that this would have been a very different looking statistical basis today, because those have been the limiting factor on containing this disease.
So when it comes to the lack of access to PPE, or at least as it existed at the beginning of this crisis, I want to help paint a picture for people who aren't familiar with PPE. Doesn't just magically appear in the closets of hospitals and nursing homes. I mean, is it mostly purchased off private sector markets? Is that something that's supplied by the government? Did the government only come in and help facilities like yours get PPE because the private sector supply chain kind of evaporated? What's the process, and why was it so hard to get that equipment?
Well, clearly hospitals have group purchasing pools, and having personal protective equipment is something that they always have in their inventory. But as hospitals began to order their normal allotments for what they routinely need in a hospital, they would find that they may order 1,000 of a particular item, and when it came in, they would have 100 or maybe none. So literally when that disruption started occurring, our members were contacting us to say, can we get access to the strategic national stockpile? Because we know that the government, the federal government and the state government, has a stockpile of said equipment for cases of natural disasters or pandemic. Unfortunately, what we found in Oklahoma, that a good number of our N95s that were stockpiled were out of date. We had to get CDC involved to be able to use those N95 masks. And so the stockpile numbers that the hospitals were counting on, quite simply, were not adequate to meet all their needs. The state of Oklahoma jumped in and have been trying to ramp up their purchasing power as well to get our warehouse built back up to address short-term needs of our healthcare facilities.
If we have a surge, God forbid, in the fall, do you think that the state now has the equipment it needs and the bed space and all that to treat a surge, or are we going to be back in a mode where we're scrambling for PPE and tests and other equipment?
Well, important to note that while we were prepared in our model for a surge that would hit, in our model we had built up to what a hospital is staffed today, plus the ability to expand by 40%. Thankfully, we never got there in April. Could that occur later? Absolutely. And we know that this virus is not contained. It can come back this fall. Until there's a vaccine, we know we're going to be experiencing this. I will tell you personally, we are very uh, conscious in our office with a very limited staff, the need for social distancing. And personally, even as we open up our economy, I'm going to be very careful about what I do in terms of who I'm around, what events I will attend. It will certainly be very slow to begin with to see that we don't have spikes through the summer because people are disregarding and feeling totally confident that this is gone. We're going to be living with this for a while, so we need to take common sense as Oklahomans and say, don't put yourself in harm's way. Don't schedule big events. Let's go slowly on reopening and making sure that we're not going to be in a backward situation.
Right. Certainly a good opportunity or an excuse to avoid gender reveal parties and other undesirable social gatherings.
Well, I believe that this whole situation has got America thinking differently. Just as we're doing this interview on Zoom calls, it's hard to imagine that we put together a pandemic surge plan via Zoom calls. This is new normal, I think, for a while. I think it's going to change business in a dramatic way, even when we get back to some sort of new normal.
So, speaking of that, do you think that in the healthcare industry, we're going to see maybe permanent trends towards telemedicine or investments in things like that?
Oh, I think that this has really highlighted the need on how telemedicine can be used very effectively. I expect that this will be a deal changer in that avenue, that while it's not what most patients would prefer to be face-to-face if possible, most patients right now are just glad that their physicians are offering this as an option so that they don't have to get out and they don't have to put themselves in harm's way. Certainly we hear this of people that are immunosuppressed or maybe are over 65 who have complicating health conditions. So I think that telemedicine, this has been the shot in the arm to probably boost the use of it for the future.
Yeah, makes sense. Going back to testing for a minute, we hear a lot about as states reopen their economies, they need access to more tests, they need to be doing more testing. If supply, and obviously supply is an issue, but if it was not, ideally, what would we be doing? Would everyone get tested? Would vulnerable populations get tested? Would they be antibody tests or COVID-19 tests? What's the ideal set of tools and testing we need to reopen and have some sort of confidence that we're doing so safely?
Well, that's really a great question. And until the governor's announcement this week regarding if you want to be tested, you can be tested, that has not been the policy because we have been limited by the ability to do testing. So before the governor's announcement this week, testing has been reserved for priority healthcare workers, inpatient hospitals, and nursing homes. And clearly, that still needs to be a priority. We are very concerned about the percentage of healthcare workers that are testing positive and the trends that's occurring. That's still trending upward. So we are very, very concerned about that. But the bottom line, to be able to reopen this economy, we have to have the ability to do more widespread testing. We were pleased with the governor's announcement this week that they are going to be testing in all of our nursing homes, and that's all residents and all staff. We think that's a hugely important thing to do, and we applaud that effort. But as that occurs, we also know that once that occurs, that the public, and we're seeing some healthcare facilities and others announce that, you can now come in and get tested even if you don't have symptoms. I think we'll see that ramp up, and that's a good thing because people really, really want to know whether or not they're positive or not, because the asymptomatic nature of this is the frightening part. The second part you mentioned was about antibody testing, and as the federal government has expedited antibody testing, we have been warned in the industry that not all antibody testing are equal, And so I think that a lot of the healthcare professionals are still working through what they believe to be the superior tests. And I think that's going to take a while to get there. And so I think that will be evolving.
So no silver bullet. We kind of need to, the science needs to catch up to what we have available.
Yes, exactly. And this is about, people being smart about what they're doing. Just because we're relaxing, some of the policies that have been put forth in place by the governor and the mayors, it's like we've got to be smart about taking care of ourselves.
Right.
And I know this is not a comfortable zone. I know that every Saturday we do a Facebook post with our families and their children, just because we don't want to risk getting together prematurely and then causing someone, to come down with a disease that someone in our party didn't know that they were carrying.
Right. And, you mentioned a lot of healthcare workers testing positive. I mean, it's, I think one thing that's sort of evolved is people understanding that, hey, these are real heroes right now. And they're going to work, not just, doing the Lord's work, healing the sick like they always are, but doing so at considerable risk to their own health and the health of their family. I mean, is that something that you can kind of feel in your association, that there's sort of a wave of appreciation for your profession that maybe isn't always as visible?
That has been the greatest part of seeing people appreciate healthcare workers, because they're truly heroes. They are risking their lives. And with the nature of this disease, that people can be carriers and have no symptoms, that's what puts our healthcare workers at risk. I kind of got emotional there. My daughter is a pulmonary critical care physician taking care of COVID patients. So this is real.
Yeah. Well, I know we're all thankful for people like your daughter for doing great work in really difficult circumstances. So thank you for that and for her service, for sure.
And you can cut that all out, by the way.
No, I think it's good. I mean, people these are real people doing really important work, and some of them are paying a stiff price for it. So I think we all need to be cognizant of that and thankful that there are.
Just like you have two kids at home. My daughter has a 3-year-old and a 5-year-old at home. So, I talk to her every day about her day and, what she's seeing, but then also, are you taking care of yourself mentally and physically? What are you doing to protect your family back home? And that's happening all across America.
Yeah. Yeah. And is it something like in between 10 to 20% of the COVID-19 cases are actually healthcare workers?
Well, the latest statistic I looked at this week, that I think Oklahoma right now, we're in the 18%. 2 weeks ago, we were at 16% positive, and it's just moving up about 1% a week. That's concerning to us because these are frontline people that are risking their lives to take care of others. So we've got to make sure that they're protected.
Is the state, as we move forward, I know that the state is facing a serious budget shortfall, but obviously the cost to hospitals in terms of increased expenses on PPE, which is not only in short supply, but in some cases dramatically marked up, more staffing needs and things like that. Is there going to be a moment when that's reconciled and the state or the federal government comes in and delivers some financial support? Has that already happened?
Well, it's interesting that the work that's happened in Washington, that there are big financial packages that, have been put together, not only to help states with recovery efforts. There's money for, what's happening in unemployment. I believe our states received like 1.25 billion for COVID-related expenses. We know that hospitals, there have been programs put together to help alleviate some of their cash flow situations, especially related to postponement of elective surgeries and downward volumes as we've gotten ready for a surge. Do I expect there to be another package? Yeah, there probably will be coming out of Congress, but this is going to have a long-term impact on not only the hospital industry and healthcare, but also our economy as well. And if there's one thing that I hope is a lesson that we learn out of this pandemic, is that we should not rely on other countries for our supplies, testing, our personal protective equipment. Our supply chain has been disrupted in huge, huge ways that have caused massive chaos to this economy because we're relying on, namely China, to produce our PPE. We need to bring that back home to America so we never find ourselves in that situation again.
Yeah, makes sense. The last thing I sort of wanted to talk about, you're talking about long-term healthcare needs and long-term needs for the healthcare infrastructure. Sort of life goes on a parallel track during this crisis, and one of the things that is going to happen is on June 30th, Oklahomans are going to have the chance to vote on State Question 802, which is Medicaid expansion. At the same time, Governor Stitt is working on his own Medicaid expansion plan, albeit a little bit different than the one that's on the ballot. What should Oklahomans know about those two plans and the state question and where the state might be heading in terms of our Medicaid population?
Well, first off, it's a perilous time for many Oklahomans. Perhaps they've just found that they've been laid off from a job that provides insurance. That's part of their benefit package, and now they find themselves uninsured. And you can bet that they're praying to God that they do not become infected with the COVID virus. So that's first and foremost of what I believe a lot of Oklahomans are thinking about right now. They want to get back to normal, but they need to protect their families too, so that they don't find themselves needing healthcare services due to COVID. Clearly, this is a discussion that we are in. The Oklahoma Hospital Association has been a coalition member of State Question 802 since the beginning. It's important to note Oklahoma has the second highest uninsured rate in the United States. So we believe that this is a really good time to be looking at Medicaid expansion, because in an economic downturn, and we know that our downturn is not just because of COVID, we know we have a downturn because of the energy sector and the price of energy at the current time. This is going to be protracted. But we believe that it's never a more important time for us to be considering Medicaid expansion would bring back 9-1 match to Oklahoma. So if we can find a way to make an investment of approximately $100 million to provide healthcare coverage through Medicaid for people that have found themselves recently out of work, or maybe they're in the service sector where insurance is not provided, bring back 9-1 match would be a tremendous boost to Oklahoma's economy right now. We think it's worthy having that conversation. We think the time is right for that. We think that this is not where we thought we would be in a year ago when we were talking about expansion, that we would be considering this in a pandemic. But unfortunately, that's where we are. And it's never more important to Oklahomans now to have healthcare on their minds, and the importance of having insurance to combat what they need in terms of if their family should fall ill.
Yeah, you'd think it would be a good time to invest in healthcare and the healthcare infrastructure as we're fighting a global disease, for sure.
Absolutely.
Well, Patti, that's really all I had to ask you. I appreciate your time. Is there anything else you want to sort of say or get Oklahomans thinking about before we wrap it up?
Well, I think that for most Oklahomans, a takeaway when we get through this, and we will get through this, is the importance of of having a public health infrastructure that's there should we need it. And there are going to be a lot of case studies when this is over on what worked well and what didn't work well. But the bottom line is we're here today and we've got to get through it, and we will. But I just ask Oklahomans to be smart about what they're doing and don't take unnecessary risk that could put their health in jeopardy.
Wise words. Thank you, Patti Davis with the Oklahoma Hospital Association, for being here with us today. And we are all rooting for you and your hospitals and your healthcare workers, and wish you the best. Thank you.
Thanks, Alex.